EMC Facebook Live. I'm Halary Patch, and we're going to talk to you about high blood pressure, also known as hypertension. I appreciate you taking this time to watch this presentation. I hope everyone's doing well. This is meant to be relaxing. We're not trying to increase your pressure by any means by talking about this subject, but it is a huge issue, especially right now with what's going on with COVID. So we're going to talk about some basic statistics in regards to high blood pressure, which you can do at home to help lower your blood pressure, and also some medical management, what we offer here at DMC to help with blood pressure diagnosis and treatment as well. So many of you may have heard or know that blood pressure is known as the silent killer. That is for several reasons, and one of the biggest reasons is that it goes undetected for quite some time. So statistically, roughly, out of every 4 men, at least one person doesn't know that they have high blood pressure, and for females, out of every 5 females, it's one that does not know that they have high blood pressure. Sometimes people have symptoms. Symptoms usually progress or develop, I should say, a little bit later stage, meaning that you've been battling high blood pressure for some time, or otherwise people will have symptoms when their pressure is pretty high. So the other thing to know is that out of all the people that are diagnosed with high blood pressure, only about 17% of them are adequately treated in terms of good blood pressure control. So what we're going to do is I'm going to refer to the American Heart Association guidelines, which came out in 2017, the latest guidelines, which state that the target blood pressure is 120/80. If you're looking for a very valuable resource online, going to the American Heart Association website is a good resource. It's something that we use here for guidelines in terms of our practice. A lot of people nowadays like to surf the web in terms of trying to look up their potential diagnosis or their symptoms. Unfortunately, there is not a lot of reliable data out there, but if you want some good data, definitely go to the American Heart Association website. So with that being said, after 2017 and the guidelines came out, a lot of people were diagnosed with high blood pressure on the basis of that target of being 120/80. And so we know that anyone that has a pressure of 130 to 139, that's the systolic pressure, that top number that we talk about, and have a pressure of 80 to 89 on the bottom, that's considered stage 1 hypertension or high blood pressure. Stage 2 is 140 or higher, over 90 or higher. Okay, and we're going to get into a little bit why it's really important to treat blood pressure and act on it much faster. The reality of it is that people are living a lot longer, which is a great thing. Part of it, or a good portion of it, is due to medical science. And although we don't always like to take medication, it is these medications that have sustained life and have also contributed to longevity for people living with heart disease. Ultimately, we have 2 ways that we can monitor blood pressure, manage blood pressure. We have the pharmacologic way, which would be medication. And use of medication decreases the risk of stroke by 30 to 40%. It reduces the risk of heart attack by 20 to 25%, and then overall heart failure by 50%, which we will talk about a little bit more. Some of the things that people can do from what we call a non-pharmacologic standpoint. would be to get regular exercise. The recommendation is at least brisk walking for 30 minutes or more on most days. Now, living in New England, it's a little bit challenging this time of year. There's a lot of ice out there. And certainly people used to go to the mall and do this, but with COVID, it has been challenging. Gyms, some people don't feel comfortable in gyms either. So, a good way of doing this could be going up and down the stairs in your house. It could be some jogging in place. Those are some things that you can do at home. Another is weight management and low salt diet, which has been a challenge to say the least during COVID. It's certainly much easier to order takeout. There's some fear associated with going to the grocery store. It's quick and easy to order takeout. And people are finding that they've gained a little bit of weight during this period of time. We all have to an extent, and we're trying to do the best that we can. Some people are stress eaters. Try not to be too hard on yourself. At some point in time, we will get through this, okay? But what is really important is that you try to institute some of those changes if you can. The biggest contributing factor is high salt. So if you can limit the salt that you're having in your diet, put away the salt shaker, use more Mrs. Dash. We ask or recommend that you restrict yourself to 3 grams a day, which is also 3,000 milligrams. You may notice if you had Chinese food or pizza the night before, the next day your ankles are swollen, and that's because you're retaining extra water. And that's what salt does. And that's how that increases your blood pressure, because ultimately it increases the circulating volume within your body. So it's really important to limit that. We talk about smoking a lot. Interestingly enough, aside from smoking, the biggest risk factor for cardiovascular disease is untreated high blood pressure. So for you folks out there that don't have a history of smoking, but do have a history of high blood pressure, it's essential to treat that because mortality rate goes up twofold when your blood pressure is not adequately treated. It is something that is very simple to address and treat, but the implications of it later on down the road are devastating, okay? One of the things that I'm going to do, I'm going to draw on here just to show what high blood pressure does to the heart over time. And I find that this is very helpful for people to understand what's going on with high blood pressure. Don't laugh at my drawings though, okay? So if we were to look at your heart has 4 chambers, okay? And from a cardiology standpoint, we look at the heart from top to bottom and right to the left, okay? Over here is the left side of the heart, and right here is the right side of the heart because it's how it sits inside of our chest. And down here is a chamber called the left ventricle. The heart as a whole is very important, but the left ventricle is really the pumping force of your heart. When people have poorly controlled high blood pressure, what can happen is the heart muscle in this chamber can become thick over time, okay? And when the heart muscle becomes thick, what happens is it also becomes stiff. This part of the heart muscle must relax to allow blood to come in and then squeeze in order to eject out. If this part of the heart muscle becomes thick and becomes stiff, it doesn't have that bounce and recoil that it needs. And this can happen over time because of poorly controlled high blood pressure. An analogy that I often use when I see patients in the office is if you and I were to go into a river that had a strong current and we were to walk against the current upstream for an extended period of time, we're talking a year, 2 years, or what have you, what is ultimately going to happen to our legs over time? The muscle structure of our legs is going to become well developed. It's going to become thick. And that's an adaptation of our body. The heart is just a big muscle, and the same exact thing is going to happen to the heart. So as the heart has to pump against high blood pressure time and time and time again, what happens is it becomes more thick. And it does that because it's a compensatory mechanism to deal with the high blood pressure. The problem with that, again, is that it leads to a stiff heart. And if it happens for a long enough period of time, as you age and get older, it sets you up for potentially developing heart failure. Now, remember in the statistic that I had mentioned before, people that have poorly controlled high blood pressure are 50% more likely to develop heart failure later in life. And part of the reason why the American Heart Association came out with the guidelines stating that we need to target a pressure of 120/80 is mostly because we got some really good data out of a couple trials that were going on that were longitudinal, so conducted over time, that told us that when we don't control the blood pressure and this thickening happens, people will develop heart failure. One thing that I hear from a lot of patients when they come in is, oh, my blood pressure is just high here because I have white coat syndrome. You hear that all the time. And it does exist. It is a very real thing. I tend to err on the side of caution. And so if your blood pressure is high here in the office, I always like to see evidence that it's lower outside of this potential stressful environment, okay? Because if it's stressful to come into the doctor's office, you might be dealing with work stress, home stress, that also could raise your pressure. We recommend that if people are concerned about their blood pressure or think that they should be monitoring it, that you pick up a blood pressure cuff. Omron is the cuff that we often recommend. We will attach a link to this on the Facebook page. So for anyone that wants to purchase it, you can. It is commonly distributed at your local pharmacy, CVS, Walgreens, Rite Aid, but you can also order it online. I recommend getting the arm cuff as opposed to the wrist cuff, which is going to be more accurate for the most part. You don't necessarily need to get the ones that have Bluetooth technology and all the bells and whistles, though if you want to, you can. I have patients that have that one and then they upload their readings and send them over to me, which is sometimes helpful as well. If you happen to get a cuff and you want to know what the accuracy is, we're happy to have you, schedule a visit with one of our nurses. You can bring your cuff in with you. We'll check a manual cuff pressure with our cuff, and then we'll check it on yours as well to make sure that they match up okay. So symptoms that you might have high blood pressure. And this is commonly misunderstood. A lot of people think that you're just going to get this headache when you have high blood pressure, or you might not have any symptoms at all. Some symptoms that indicate that you might be dealing with high blood pressure include the headache. Sometimes people feel chest pressure or pain. People can feel short of breath when they are trying to exert themselves. You may get a flush feeling or a warm sensation that comes from your neck up over your head. Feeling exhausted, that is actually a symptom. You're not just getting older, you could actually, in fact, be having a blood pressure that's higher than not. Think about a time where you might have gotten in a small argument or dispute, or you were dealing with, some emotional stress. How did you feel after that? Did you feel wiped out and tired? Did you kind of have this dull headache? If you did, and most of the time the answer is going to be yes, it's because your pressure was a little bit high at that time. And that's normal, that happens. But if you're feeling like that on a day-to-day basis, that's a little bit of a different scenario. And that might prompt you to call and schedule a visit to come in, or if a family member has a blood pressure cuff, go ahead and check your blood pressure at that point in time. Going back to medical management, some patients don't want to be on medication. And unfortunately, the average American right now is on 3 blood pressure medications. And that's not because we're on max dose of all of these medications. We used to start someone on a medication and go all the way up to the top, highest dose, and then we'd start them on something else. We have learned over time that the heart muscle responds much better to a combination. And the reason being is going back to this thickness. What we aim to do is try to what we call remodel. So if we can decrease some of this thickness over time, that is ultimately the overall goal. Now, it is possible. Some people have hypertension or high blood pressure because it's genetic, but it is possible to reverse some of your high blood pressure if we think that it's due to primary causes. For example, being overweight, inactivity, smoking, a high salt diet. Those sorts of things are modifiable behaviors, which oftentimes when people are able to, change their diet or lose weight, we'll actually see a decrement in the blood pressure. For example, roughly 2-pound weight loss results in 2 millimeters of mercury and a decrease of pressure. So if your top number is 146 and you lose 2 pounds, then you're going to have that impact on your blood pressure to drop it to 144 and so on and so forth. So most people put their weight on in their abdominal region. In your abdominal region, you have a major vessel, the aorta, that stems from the top of the heart and goes all the way down. If you can imagine putting that pressure on that aorta, it increases the pressure back into your heart. So if you were to target just one area only, working on that core and that abdominal region is huge, okay? So keep that in mind. The other thing that contributes immensely to blood pressure is sleep apnea. People are, I know right now, just shaking their heads saying, there's no way I'm going to get worked up for sleep apnea. I'm not going to wear a mask. But I have seen patients in the office that have been able to come off blood pressure medication, have lost weight as a result of treating their sleep apnea, which inversely, because their sleep apnea was a weight issue, eventually didn't really need to use the CPAP machine anymore. So sleep apnea ultimately puts a lot of pressure on the heart, but it also increases your blood pressure. It also remodels the heart muscle, puts you at risk for stroke, these sorts of things. So if your spouse is sleeping in another room because you snore too loud at night, or you're waking up frequently in the middle of the night, you're not feeling rested in the morning, you might want to consider getting worked up for sleep apnea. It is a major issue. It's quite simple to actually fix, and people generally feel much, much better when they're treating their sleep apnea. Julie, who is our heart failure nurse, will also be speaking next week on the 23rd about a low sodium diet. So she'll specifically talk a little bit about the DASH diet, which is the recommendation in order to help lower your blood pressure. So the DASH diet includes low sodium foods that are rich in potassium, magnesium, and calcium specifically. So they'll touch upon that next week. The big question I always get is, how much alcohol can I have in terms of how it impacts my heart? The bottom line is men and women, it's a little bit different. Ladies, unfortunately, we, can't have as much as the men. And I know we all want to justify the red wine being heart healthy, which it is, a heart healthier option if we were to have wine. But the recommendation is no more than 20 milliliters a day of alcohol for a female and 30 milliliters a day for the men. So keeping that in mind. If you do have high blood pressure and you've been on medication for it, you might see certain medications like hydrochlorothiazide, lisinopril, amlodipine. These are phenomenal medications that work really well in terms of managing blood pressure. They have a low side effect profile. For people that don't have blood pressure that's well controlled, we often talk about this in our office. Aside from leading to potentially heart failure and stroke, over time it can lead to kidney dysfunction, which is a big thing. Nobody wants to, predict down the line that they might be at risk for going on dialysis. So preserving your kidneys, and certainly if you have diabetes, that's another risk factor. But additionally, another is, sexual dysfunction, which that is something that's talked about in our office here. As people age, that can be an issue, but certainly blood pressure is a big contributing factor to that. We have a lot of people that don't want to take medication because they feel that they will have more sexual dysfunction being on medication. It's actually the reverse. And likely the poorly controlled blood pressure over time has contributed to that problem as well. Some things that we can do to help manage our blood pressure, okay, other than exercise and diet at home. I think the biggest thing right now is we're not able to get out like we have always wanted to do. Like I said, people aren't going to the gym. Sometimes we're trying to be creative and finding ways to alleviate stress. And so some things that you can do, I mean, honestly, I drink tea. I find that, a good chamomile tea helps to relax. Meditation or yoga at home is another real helpful resource. Some people I've found during this winter time, people are getting outside and snowshoeing. That's another option. For all you gardeners out there, the warmer weather's coming and you'll be able to get outside and do those things. But really managing blood pressure has a lot to do with stress management. And that's really important, because when you release those sort of chemicals, those endorphins, as well as cortisol, it increases your blood pressure and increases your heart rate. So finding what your niche is, having that time to, like I said, meditate, having your alone time, put on a show that maybe is relaxing, that's helpful as well, aside from the diet. But the stress relief is the biggest thing. Here in our office, we actually have this little guy, which some of you guys may have seen before. This is Bo. He's our little French bulldog that we have, and he came in. We call him the COVID puppy, but he's been great. Animals are a great source of stress relief as well, and so certainly your dog's going to want to get out, go for walks. And get you out of the house, which is a really great thing. Animals are very therapeutic, okay? Another thing is connect with other people. It's really important if you can find a support group, connecting with your family, whether it's through Zoom, go ahead and do that. At some point, we'll be able to go on vacation. That's another thing that people do for stress relief. But keep in mind that we're all in the same boat together. Be patient with one another. And if you find or you question that maybe your blood pressure has been running a little bit high and you want to inquire about it, feel free to reach out to Dairy Medical. You can get in with your primary care provider, but we are happy also to see you here. Like I said, if you have a blood pressure cuff and you want to kind of be proactive about that, we could bring it on in here, and we'll check it to make sure that that your cuff is accurate. But again, we're here as a resource. Feel free to call, and if you have any questions, just let us know. But I hope that you enjoyed this presentation. Thank you so much for taking the time out of your busy day to watch this. And everyone, please stay safe and healthy. Best of luck.